Hi, my name is Steve McClelland, and I've been married to your professor for over 26 years. And I know a little bit about prostatic hypertrophy, one, probably because I'm getting older myself, but more importantly because I'm a practicing internist in the area, and I see a lot of aging patients who run into this problem. And so Molly asked me to speak to you a little bit about BPH, what I talk to my patients about, so that they understand what's going on, so that they can better comply with their treatment regimen, etc. So I'll just jump into what I usually talk to my patients about when they come in complaining of this and we make a diagnosis. What I usually do is draw a little picture, and that little picture represents the bladder here. Obviously the ureters kind of bring urine down from the kidneys into the bladder fills, and the urine passes them through the urethra and then out of the body. As the urethra courses out of the body, you have the prostate. It's a walnut-sized gland, and the urethra actually passes right through the prostate. And if we were to take this picture and what happens here is you have your sphincter muscles up above that actually allow, with relaxation, the bladder to empty its contents and pass through the prostate on its way out. What happens here as the prostate gets larger, we can see the prostate enlarges and the urethra still passing through the prostate. The bad news is that the prostate is going to enlarge in 3 dimensions and not just 2 dimensions in my picture. So what typically will happen is you'll start to get some pinching in of the urethra, and this impedes urinary flow. If you look at this end on, we're going to kind of draw a cross section right through here. I'll use a different color. We're going to kind of slice it and take a look at it end on. We're kind of looking at this from above now, and this is the prostate with the urethra passing through it. And as I just talked about, the prostate's getting larger, and it's also making the opening through it smaller. Now this is all well and good, it doesn't seem like a big deal, but what happens is urine flow actually has a harder time getting through here. And you say, well, can that little bit of difference make a person have a hard time emptying their bladder? Well, it all goes back to your geometry days, and it all gets down to this formula. Area of a circle equals pi r squared. That's really a cool formula on the surface until you start to think about it. Why is this important? Well, the area of a circle is actually the thing that has the most impact on it is the radius squared. So as we start to get narrowing of the urethra in this situation, start to pinch down on the urethra, we get exponential changes in area. And so the best way to demonstrate this is next time you go to McDonald's is get yourself one of the McDonald's straws. They're really smart at McDonald's. They make their straws a little larger than a normal straw, so that when you're having your 32-ounce Diet Coke, you can really suck that thing up really fast, and you know that you can get a lot of flow through there. Take a regular straw, or even take a coffee stirrer, and try to suck up that 32-ounce pop. You're going to be there a long time. You're going to be exhausted by the time you try to drink that whole thing. So here's what happens when we put it all together, is that urine flows down the bladder during when the patient urinates. The bladder should totally basically expel its contents and can collapse down on itself almost. And then as it fills back up. Because the bladder doesn't have any voluntary muscle, the only voluntary muscles are right here. It has smooth muscle in it. The bladder lacks the ability to push down and empty its contents out. So instead of going through the McDonald's straw down here, it's now going through the coffee stirrer. And this bladder, because it lacks the ability to push fluid out, can only contract so much. And so the bladder, instead of emptying all the way down, only empties about half full. And the bladder just continues to expand and contract, the patient will typically complain of symptoms of having to urinate frequently. They think they're urinating normal amounts, but actually it is not a normal amount because this has been happening over a long period of time. But they think, oh, I'm urinating normal amounts more frequently, but what's really happening is they're excreting very small amounts, and they're doing it all day, all night long. They're getting symptoms of nocturia because the bladder can't completely empty its contents. So the treatments, there's a couple. First things we recommend is usually to avoid things like caffeine and stimulants because that can have an effect on smooth muscle. And if you remember from your anatomy that you just went through not too long ago, that the lining of this urethra is lined in smooth muscle. So avoiding caffeine, Sudafed, chlorotrimazole, Dimetapp, Benadryl, all those medications can make a difference. Chocolate can make a difference. The second thing that we do, if that doesn't work, we ask the patient to try an alpha inhibitor, Terazosin, Hytrin, some of the is the brand name, Flomax, you've heard of that one, I think, and if you haven't, but these are all alpha blockers, and what they do is they dilate up smooth muscle, allow it to relax a little bit, and just again, just very small changes in the size of the urethra and the diameter of this can make big changes to the patient's ability to empty that bladder more fully. The next thing we do, that usually lasts a few years, and we're usually on to another medication. We use a medication that's a testosterone blocker. The most common medication for that is finasteride. There's Avodart and a couple other, Jalin is a brand name, but you'll remember back in your dihydrotestosterone pathways. So it was important that you guys paid attention to those lectures because it all comes together, even remembering your geometry back in high school. Once those medications no longer work, the next treatment is to send them off to the urologist. The urologist will meet with them and talk about going in, this doesn't sound so fun, with a cutting device, and they go in through the penis and through the urethra, go in here and basically core the apple out so that they open up and open up this restricted area. And hopefully that's a definitive procedure for the rest of the patient's life. Sometimes it's not, and they don't like to have to go back and do it again, but they'll usually reserve that procedure till later in someone's lifetime. So that's a little bit about BPH, a lot of it about BPH, probably everything you'll ever need to know about BPH as a nurse. Molly probably talked to you about trying to pass a catheter through there, but that's exactly what you're running into, is that prostate that's enlarged. So hopefully you remember that stuff, and hopefully that ties back into all the other stuff that you learned in the past. So thanks for having me.